Your eyes are the only place in your entire body where you can actually see your blood vessels. They are truly the window to our body because what's happening in those blood vessels are mimicking what's happening in the rest of our body. And that's why people with diabetes, high blood pressure, cholesterol, they should be having their routine exams.
If you want to live like you matter, ditch the pills, look great, and feel freaking amazing, you're in the right place. I'm Dr. Wendy Trudeau.
And I'm Dr. Ed Levitan. Welcome to the Feel Freaking Amazing podcast,
where we empower you to live a vibrant and healthy life by optimizing your structural, chemical, emotional, social, and spiritual lives.
Hold on to your hats.
Hello, and welcome to this episode of the Feel Freaking Amazing podcast. I'm Wendy Trudeau. Obviously, Ed's not here today. And today we have Dr. Meenal Agarwal. She is a board-certified optometrist and spatial awareness expert who has pioneered a holistic approach to vision as a gateway to brain health, longevity, and overall well-being. Her work integrates optometry, neuroscience, and lifestyle medicine to address the root causes of visual problems and their impact on cognition, focus, and neurodegeneration. Meenal, welcome. It's so nice to have you here.
Thank you for having me. My pleasure.
It's great. So let's dive in. Are there ways in which hormone changes affect the eyes?
Yeah, absolutely. I mean, I'm going to say the biggest one is dry eye disease. 60% of menopausal women experience dry eye disease, and a big part of it has to do with our hormones. So it's not even only the estrogen, progesterone dropping, but it's also the androgens dropping, which is kind of a shocker for a lot of people. But that directly impacts two main glands, which produce tears, or good quality tears. And those are called the meibomian and the lacrimal glands. And when they're not producing that good quality oily tear film, we're getting dry eye disease. So we're getting kind of a double whammy because we're sitting on our computers all day. And then we're also having these hormonal shifts, which affect our whole body. So, but definitely the eyes, I'm going to say that's the biggest change that, really affects women, is that dry eyes. And, people sort of pass dry eyes off as, okay, it's just dry. But no, women come in every day suffering with it, whether it's light sensitivity, blurred vision. A lot of times we think it's their prescription, but it's dry eye disease, inflammatory symptoms, itchiness, redness. They want to rip their eyes out, especially in the mornings. These are scary issues that can be solved with proper treatment, but a lot of people just ignore that dry eye part of it, or think, it doesn't matter, it's just my eyes.
I had my eye exam in, I think it was February, and she said something to me, and she said it to me last year, and I said, what does that mean? I still can't actually remember what she said. And she says, that means you have dry eyes. I was like, oh, well, why don't you just say that? I actually didn't realize that I had dry eyes until she straight up said that. She said something like, there's like cuts on my cornea or something. What do you call it when there's?
Yeah, so we call it punctate keratitis, which are little dots that we see. And I like to compare it to like eczema or dry skin. When you see like the dots of dry skin flaking off, that's exactly what we see on the cornea. So we call it punctate, little dots of keratitis on our cornea. And that is definitely a sign of dryness or dry eye disease. But the other thing we look for is meibomian glands, which are our glands right on our eyelash margin where our waterline is. And they actually contain the oils, or they secrete the oils that help stick the watery tears to our eyes. So if they're not functioning properly, we call that meibomian gland disease or dysfunction. That's a huge part of dry eye disease. That's when people complain of watery eyes. So I'm sure I have a lot of patients that say to me, no, I don't have dry eyes. I have watery eyes. And I'm like, no, that is dry eyes, because they're watery because they're not sticking to our eyes. So they're useless to us.
Got it. Okay. So that was so funny when she said that. And I went, wait, I have dry eyes. And so I went home and I started taking 3 grams of fish oil every day. And it was about 4 months ago. And what was so interesting is I didn't really realize that it wasn't normal to have your eyes feel gritty when you wake up until it went away. And I was like, oh, okay, then that was not cool. I just thought every morning I just kind of had to let my eyes wake up or something,
An interesting fact about that, it's the action of the two lids coming together. So a blink is actually what helps to stimulate the secretion of the oil from the meibomian gland. So at nighttime, we don't blink. I mean, our eyes are supposed to be closed. So that's why we're driest in the morning. It's like you're peeling your eyes open because there is no stimulation.
Oh, interesting. Okay, because I would go like blink, 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 blink. And I was like, well, I don't know why this feels good, but it does.
Yeah.
So that's really interesting. Okay. So in addition to hormones, what are you recommending for a dry eye treatment? I can't tell you how many people have dry eyes who I know.
Yes, absolutely. So I think, my lifestyle changes would be blinking more. I mean, we do not blink on devices. And this would apply for everybody, even the youngsters. We're supposed to blink 15 to 20 minutes, 15 to 20 times, every minute, but we're blinking 5, 6 times every minute. So it's when we're on a device. So, blinking more. Staying hydrated is another big thing that definitely helps your tear film quality. So staying hydrated helps your whole body. And then more of therapeutic, I'm going to say we like to recommend non-preserved artificial tears. That's huge because, and it being preservative free is a big one. We have to all jump on that bandwagon of clearer products. So cleaner products. So preservative-free tears at least 2 to 3 times a day. And I think another big one for women is makeup. So, staying away from the preservative, toxic sort of makeup products, knowing your clean ingredients, the less preservatives, the better it is. You'd be surprised. I mean, I used to wear mascara and I would have to take it off within an hour because it would be stinging. I have dry eyes, so it would be stinging and burning my eyes even more. But when I started looking at different products that had cleaner, less preservatives, cleaner ingredients, I can now wear it, longer. So I think that's so important for women to start, making that shift as well. Yeah, and eating healthier. So omega rich foods is huge for dry eyes diseases, right? So keeping with the omega-3 fatty acid foods, or even taking supplements will really help with dry eye disease. But I would say nutrients, lifestyle changes, and just taking breaks on your devices.
I had someone who's an ophthalmologist say every like 15 minutes, look beyond your screen, look 20 feet out, just so that you're reminding the eyes to look differently, so that you're not hyper focused on this thing right in front of you. So keep looking out. So I do, like, even when I'm recording, I'm like, oh, okay, when you're talking, I'm going to look over there.
Yeah, that's great. We call that our 20-20-20 rule. So exactly what you said, every 20 minutes for 20 seconds, look 20 feet or just far away. So, I like to have, like, when a lot of us work from home now. So, I mean, that's a big, big wave. So when you're set up, in your room, and your desk should be close to a window, so that you can look outside, and your window usually has a far distance. And that's important because you are resting your muscles versus looking up close. If you're going from your computer to your wall, which is only like 2 feet away, that doesn't make a difference.
I know that there's a relationship between hearing loss and brain health. Is there also a relationship between eyesight loss and brain health, or some other type of eye dysfunction and brain health?
Absolutely. And 50% of our brain, or 50% of our brain's real estate, I should say, is spent processing vision. And it's crazy, but that's the stat. And 10 to 15% is hearing. And their other senses are a little bit less. That's huge. So when you have visual impairments, your brain is working so hard to process visually that absolutely, and I cannot tell you that how many Alzheimer's dementia patients that I see with cognitive decline that have visual impairments related to that. And, their kids or they themselves are wondering, like, I don't understand where I got this from. And if they had corrected their vision sooner, we think, and, studies have shown that they can definitely have prevented that decline.
This is like really freaking me out. What are some of the things that we want women to look out for, and men? Like, are there warning signs and symptoms that if you experience these list of things, you should walk yourself into your nearest optometrist, ophthalmologist group? What are those things?
Yeah, I mean, I think they're pretty basic. Obviously, if there's any pain, burning, stinging odd feelings in your eyes, go to see your optometrist. But some of the bigger ticket items would be vision loss. Even if it's transient, what I mean by that is even a couple of minutes, that can be signs of a stroke. So we want to, vision changes. And I always encourage patients to, cover one eye and then the other, because remember, they compensate for each other. So if you're not sure, cover one eye and cover the other really quickly to see if it's a true loss.
Now I have to do it while we're talking.
I know. And they don't have to be equal, but at least know if if you are having visual loss, because if you're having it in one eye, the other eye might compensate for it. So, doing this regularly, just checking, but any permanent changes in vision as well, like all of a sudden your vision changed or became foggy. That's also pretty big. Flashes and floaters. So we call it that casually, but they're little dark spots, blackish gray. A lot of people have them that float around in our vision. If we're seeing a new onset or change in the number of them, you need to see your optometrist right away. And then flashing lights. So you will not see flashing lights colored. So colored flashing lights are usually indicative of an ocular migraine or a migraine, because the brain is the place that perceives the color part of it. But if it's truly your eye health, so your retinal health, the flashes will be white. So when patients come in to me and say, I have flashing lights, I need to see you right away, and they're like, they're purple, I feel so much better. Right? So I would say those are my big ticket items where we consider emergencies. Obviously, they're the smaller things like redness, and other symptoms, but.
Do you find that it's hard for people to advocate for themselves within the healthcare system for eye health?
Yes, absolutely. For some reason, I don't even think it's just eyes. I think across the board, and then we just fall into that category where they've felt gaslighted. And I think all these years they've felt gaslighted. And so they come into us and expect that they will be gaslighted. So they don't want to advocate. I love when my patients come into me and say, hey, I looked this up and I feel I could have this. I know a lot of doctors are against Dr. Google, but I am so pro it. Unless you're a hypochondriac, I'm very pro it, because our medical system has so much gaslighting in it. And also there's a lack of, care and a lack of doctors, such that where are they supposed to turn? I Google things for my kids or for myself. And then I go into my doctor and say, hey, I might need this. If my doctor says, no, you might not, that's different. But at least having that idea, I love when my patients can advocate and come in and say, hey, I'm having these flashes. I'm having these floaters. Could I be having a retinal detachment? I'm like, okay, let's just check your retina. Calm down. Don't worry. It's a small percentage of people who do, but I'm glad that brought you in, because if you didn't Google that, then so I don't know why we don't allow our patients to advocate for themselves. And I really hope more doctors, they change and recommend advocating for themselves.
Yeah, I think you can't open a closed mind, but certainly new generations of providers who experienced gaslighting may be less likely to gaslight, hopefully, right? At least hear
Absolutely.
people. Okay, what are things that women can do preventively to protect their eye health?
Yeah, absolutely. So, the biggest one is food that we intake, and nutrition, and sugar is a big one as well. Lutein, zeaxanthin, which are carotenoids, rich foods. So anything colored. So that's kind of where a myth about carrots came from. But really, we're looking at all the colored vegetables, colored fruits. The berry class is huge. Kale, red pepper, anything colored. That pigmentation has lutein and zeaxanthin in it, which is super important for our eye health. It goes right to help reduce oxidative stress on your retina, which helps with diseases like macular degeneration. So the macular degeneration stat is huge in women. 2/3 of all macular degeneration patients are women or female. So, that's huge. And that's why eating healthy is so important. And then, of course, the omega-3s, adding that on for dry eyes. Then there's other nutrients like zinc, vitamins. Vitamin E is great. But the most important would be those three compounds. Sleep is huge. Sleep is great for our whole body, but to regulate our circadian rhythm and prevent eye strain, that is really important. And then that goes hand in hand with being off our device for a couple of hours before bedtime, because that blue light coming in disrupts our circadian rhythm and causes more eye strain, tiredness, everything overall. Another thing is when you don't sleep well, your blood sugar usually is not as great or fluctuates, and your metabolism is not usually great. And we know that we see a lot more women have complications related to diabetes, blood pressure, cholesterol in the eyes than, male counterparts. So I think it's important. Again, sleep for blood sugar management, especially for women. Other things include being on your device or anything up close, so near work for long or extended periods of time, that sort of sedentary lifestyle, and not being outdoors as much is a big thing as well. Most, especially with the new generation and the children and our children, they're on their devices a lot and computers. They're not getting that outdoor time, which really, affects the eye health. And UV protection. That's a huge one. So wearing your sunglasses, but not just any sunglasses. They should or have to say UVA, 100% UVA and UVB protective. Or the other way it can be written is UV 400, which means it's cutting off all the wavelengths of light under 400. And that's really important. Your vision or your eyes are really the window to your body. So listen to your eyes, have your regular visits, make it like your physical where you're going annually.
Do you recommend people wear blue light blocking glasses?
Yeah, so that's a big debate in our field. And, I want to say that studies have not proven that blue light causes disease. We are still undergoing studies. We probably won't find that out for years, but we know that there is a harmful component in it. So I do recommend it to my patients. Because we don't know. So why not add it on to your glasses? And B, it does help regulate your circadian rhythm. We know that for sure. So it will help us sleep better, especially for those of us and children that are all on their devices, at nighttime. So I don't think there's a harm to add it on. Anecdotally, my patients do say that it helps with digital eye strain. That's anecdotal. I've tried it, doesn't help me. I don't notice the difference. I do have some patients that say with blue light filter glasses, the contrast of things is slightly different, which makes sense because it's filtering that wavelength. So really, I would just say try it. If it works for you, please, keep it on. But I don't think it's mandatory.
I mean, I don't think you're going to harm yourself with it, which is what I like, is that there's no risk and there might be a potential high upside. So might as well. I'm really struck with everything you're saying, that there's this commonality to, right? We're talking about eye health, but when you're looking at heart health, brain health, gut health, menstrual health, female health, man's health, reproductive health, all of these things really do funnel into a very consistent commonality in terms of the foundations of our health, right? Eat well, sleep, move your body, get outside, have good relationships, don't be on a screen too much. The things you're saying for the eye health are all the things I would say, right, to live long and live well, you're going to want to do these anyway.
Absolutely. And a lot of those conditions that if you don't make all those good lifestyle choices, all those conditions, those metabolic syndromes and everything affect your eyes equally. And I think that's huge. And your eyes, people don't realize this, but your eyes are the only place in your entire body where you can actually see your blood vessels. Nowhere else in our body can a doctor just see you and look at your blood vessels. But your eyes, that's what we're looking at when you go for an eye exam. So obviously, I can't stress enough having those regular eye exams. They're truly the window to our body, because what's happening in those blood vessels are mimicking what's happening in the rest of our body. And that's why people with diabetes, high blood pressure, cholesterol, they should be having their routine exams.
Okay. Meenal, this is cool. Where can people find out more about you? And we'll put everything in the show notes so that it's easy for them to find.
Yeah, you can find me on Instagram at Dr.Meenal Agarwal. And I also have a podcast called Uncover Your Eyes, The Truth About Health and Wellness. Yeah. Thank you for having me.
Thank you. Thank you for joining this episode of the Feel Freaking Amazing podcast. And really, the eyes are the window to the soul. So we want to see inside you and keep you healthy. So thanks for joining us today.
Thank you.
Were you inspired and empowered today?
Don't forget to follow so we can help you keep transforming your health.
Until next time.